Can everybody hear me?
Yes.
Okay, now we understand that you just had lunch. So if you hear us sing and dance and talk, we're going to try to keep you up. How many of you are here in Bexar County? You raise your hand. Okay. How many of you are outside of Bexar County? How many of you exactly don't know where you're from and you're still trying to find yourselves? Okay. Well, I want to thank you for joining us today. We know you had a choice of sessions to attend, and wow, what a great, I think we've got a full house. We've got for the next 50 minutes a presentation for you that is going to cover the services that are available here in Bexar County. We are fortunate to have a broad array of services here in Bexar County that are delivered by the Center for Healthcare Services. In the early 1960s, some of you may remember that President Kennedy began the deinstitutionalization of mental illness, persons in mental state hospitals. That was followed by the promise of dollars that never arrived. And so consequently, states across the nation were in a situation where they had to come up with a local mental health service delivery system. The state of Texas decided that it would formulate an MHMR system across the state and assign one mental health authority to each of the roughly 42, 43 localities. Because Bexar County, Houston, and Harris County are so large, they each got one mental health authority. So Aaron Diaz will speak with you in a little bit. Catherine Jones and I, we are with the Bexar County Mental Health and Mental Retardation Authority. You don't have to remember that name because we changed it. In 1966, the Mental Health and Mental Retardation Authority of Bexar County was incorporated. In 1989, the Board of Directors for the Center for Healthcare Services decided that that name was too stigmatizing, and we changed our name formally, and now we are the Bexar County Mental Health and Mental Retardation Authority, doing business as the Center for Healthcare Services. So our colleague Lewis is probably already or is going to put a handout that's going to detail all of the services that we provide for your dining and dancing pleasure. Now, if you don't want to take notes and you want to sit back and relax, all you have to remember is to go to the internet and punch in diversioninitiatives.net. We will have this PowerPoint available for you immediately after this presentation. Diversioninitiatives, one word, .net. And if you go to that site, as a bonus, today only, you'll receive a whole array of other services and articles relative to the provision of mental health and substance abuse services offered by the Center for Healthcare Services. Now we're going to divide our presentation into three parts. We want to make sure that we leave a sufficient amount of time for you to ask questions, because we want you to be able to leave here today knowing who to call or where to go to get information. The bottom line is we want to provide to you, it seems like those of you in Bexar County, we're going to be able to tell you what's going on. Those of you not in Bexar County, we're going to say this is a model that we have implemented, is successful, and is working, particularly with those of you that are dealing with guardianships or in cases where your clients or folks that you're working with have a particular mental illness or need for a service that involves mental illness and substance abuse services. The Center for Healthcare Services provides a distinct set of services to the population, to an adult population, the adult population, the children's population, and a third population, and that is developmental disabilities long term. So within the adult realm, we provide services for individuals that have major mental illness, and we provide services for children that have mental illness. For adults, we also provide services that include substance abuse and detox services and an array of services as well. For children, we do the same thing. The developmental disabilities is also provided depending on child and adult status. Now, we are a womb to tomb service agency, unfortunately. I mean, literally, womb to tomb. When babies are born, some of you may be aware of, some of our children are born, infants are born with developmental disabilities. The Center for Healthcare Services has an ECI program that provides services to the child immediately upon recommendation or identification by the pediatrician or the obstetrician attending that services. We wrap services around the child, as primarily around the mom and the family, to provide supportive services from 0 to age 3. At age 3, they become what we classify as children and adolescents. From age 3 to age 17, we provide services to them as children and adolescents. These services range all the way from services that are tuned to crisis intervention, as well as standard casework and family services. We are only going to begin to touch the surface today for you. Now, with respect to additional services, we have a rather robust series of programs that address services to clients that are what we call justice involved. Because our consumers, our patients, tend to come to the attention of law enforcement, we've developed diversion initiatives or jail diversion programs that work specifically to intervene, to provide early identification, early access to treatment, and continuity of care to those individuals. So if your clients become involved with law enforcement, we'll be able to share some information, and Aaron will touch upon that. The Center for Healthcare Services has really led the way in the provision of collaborative services across the board. We have, again, yes, sir.
One question. You had indicated that, I mean, I'm not from this county, but you had indicated that the other authorities, are they mandated by state law to have the same types or programs that you have, or not?
House Bill 1132 that was passed in, I want to say 2005, mandated that each mental health authority provide a diversion initiative plan, a plan to implement services for jail diversion, for the diversion from jail to this population. So it is a contract requirement by the Department of Texas Health and Human Services to have, every county must have a plan in place. I can't tell you what your county's plan is, but they do have a plan filed with the state. Don't you?
So the individual services then are not necessarily the same county to county. They could be different.
Right, and the services that are mandated are generic. For example, there must be a process in place in every county to address a person that is known to have mental illness or substance abuse, that the local mental health authority have a procedure to divert that individual. In Bexar County, we started in 2000, so that is a very robust system. And you'll see that in just a second. Great question. And we're going to leave time for questions in a little bit. Okay. All right. Collaboration. It's an unnatural act between two unconsenting adults. This speaks to the fact that a lot of the efforts that we've been able to have come to fruition has been a consequence of many of the folks that you've been talking that are sitting on the table, sitting around the table. I saw Judge Rickoff. Judge Spencer will be addressing you all. She has actually been the chairperson of the diversion initiatives for us. So you've got a lot of folks right here at this conference that have been involved in developing a system of care that involves all 46 intervention points in the jail diversion system, from the very first point of incarceration all the way to incarceration, to the release of incarceration, and even from return from a state jail. So we have a system that is coordinated, that provides an array of services: mental illness and substance abuse, as well as a series of other initiatives. There are really too many. There is, for example, a facility that Mr. Diaz will talk about, and you'll see what we call Palo Alto, and that is dedicated. There are 8 initiatives out there that are dedicated directly for the delivery of services. We coordinate all of these services towards or via the Crisis Care Center. The Crisis Care Center is a set of services that actually came to be as a consequence of community input. So at this point, I'm going to stop my piece, and I'm going to introduce Mr. Diaz. And Mr. Diaz will take you through the adult and child world for the diversion of individuals with mental illness through the system. It's how we interact with the systems and the kinds of services that you may want to know more of.